I'm Nicola Dalbeth from Auckland, New Zealand. It's really nice to be with you again today. So I'm going to talk about a couple of really interesting posters that have been presented at the 2020 ACR meeting that address the uncertainty that we currently have about which advanced imaging test is best when we are thinking about diagnosis of crystal arthritis. So the first is poster 0647. This is a study presented by Jasvinder Singh in collaboration with Tristan Pascal. So this is a study that compares dual energy CT with ultrasound scanning for diagnosis of gout. It's a prospective study of accuracy, and in this study they recruited participants who had a possible diagnosis of gout, diagnosed gout using microscopic diagnosis, so really the gold standard. And they compared a couple of, well, they had a couple of questions. First of all, which site is best to scan? And secondly, which modality, dual energy, ultrasound, or both, is better and most reliable? So really the take-home messages from this study are that dual energy CT scanning of the feet and ankles had the best overall performance, that adding ultrasound in fact didn't have additional benefit, and also the feet and ankles are the best site, and adding in the knees really didn't have any additional benefit. So overall, the sensitivity for dual energy CT was 87% and specificity was 100%. So the sensitivity is a bit higher than what we've seen in other dual energy CT studies. But certainly, I think in this particular study that was very, very well performed, dual energy CT seems to be the best single test. The investigators do make the point that if you don't have dual energy CT, ultrasound is certainly a good alternative. The second study is poster 1542, and this is another study that compares dual energy CT and ultrasound, and this is a really interesting study because it's looking at differentiation between gout and CPPD. So again, both of these conditions were crystal proven, so again using the gold standard for gout and CPPD diagnosis. And overall what they found was that dual energy CT again performed best for gout. Again, kind of surprising given again what we know about ultrasound, but certainly very good diagnostic performance here. But it had a lower overall performance for CPPD, and certainly ultrasound performed much better for these investigators for CPPD with a specificity of 90% and sensitivity of 88%. So I think the overall message here is that if you want to diagnose CPPD and you're thinking about advanced imaging, ultrasound is still the preferred option compared to dual energy CT. Of course, it's not all about diagnostic accuracy, particularly in the context of gout, where ultrasound overall may still have very high sensitivity in particular. And we also need to think about other aspects such as ionizing radiation, and of course, ultrasound has benefits in that respect. And also convenience to the patient, the ability to scan and get results in real time. So I'm certainly not suggesting that this is the that we shouldn't be using ultrasound for gout, but certainly I think ultrasound is the preferred option for CPPD. Thanks.